with everything new, there's some resistance. People are just not sure how it's going to work. They're maybe a little bit afraid of the technology or how's it going to interface, but it's so simple. And so I think as that, someone else I had a patient in the waiting room that they overheard me telling a patient, oh, the next time you could do by virtual visit if that's easier from you. And they're like, start selling it themselves. Like, oh yeah, I've done it before. It's so great. It saves so much time. So, and I think it's been the same thing with the providers. At first you're like, oh, is this really going to disrupt things? Am I going to be able to still have the same patient-physician relationship and do the same things? And then you realize that actually it makes your life easier. You don't have to get up and there's not so much movement. You have to get up and go to the next room. You can see patient after patient after patient without spending some of your timing walking back and forth and doing some logistical things that aren't as meaningful. So I think you can actually spend more time with the patients and things like that. So I'm excited. I see it. I think it's the way of the future. I think it just works better, and I think as people become more comfortable with it and comfortable with the technology, it's obviously the great things are convenience. Like I've had multiple patients just take a little work break at their work day. They don't have to take a day off work. They don't have to drive. And for our patients, of course, they have a lot of specific things, like some of them have driving restriction, so they can't drive. So it means they have to have a caregiver or a family member bring them. So it reduces a lot of that burden. So that feature of convenience helps. The other thing is for the subspecialty care, the high-level care, it's not always accessible. So it really helps bring access to patients who otherwise might not be able to see an epileptologist. Like we said, there's a reason that many times they can't drive. Also, seizures in public are not always a minimal thing, and they can stay in their home, and if something happens, they can call off without having to worry about what's going to happen in the waiting room, what's going to happen, like if they're having to take public transportation, those sorts of things. I think also we have a subpopulation of patients that have seizures who also have other neurological diseases, such as stroke as the reason for their seizures, or multiple sclerosis. And they, of course, have this accumulating neurological disability sometimes, so it's not easy for them to get in and out of vehicles or, get in and out of elevators and all those sorts of things. So it really does fit for neurology. But I think epilepsy in general, too, most of our ability to manage the patient is based on clinical history and talking with the patient and counseling and deciding together what's the next best medicine. So that really is facilitated just fine with video conferencing. We're not relying as much on a physical exam as some other subspecialties. So it really fits well for us, and even more so for us in the Epilepsy Surgery Center. Like I said, a lot of times what we're really trying to do is have little short communications. We did all this testing, here's the results and the next step. They're very short visits, but instead of them having to take a plane or fly in or, wait for me to have time to fit a phone call in, we can sort of schedule this, have this visit. They can have the opportunity to answer all the questions. And same thing, even right before surgery. I've done a couple recently. There were patients that were just sort of had some last minute anxieties, and instead of just, waiting or saying, well, we'll talk to you when you get here, I could say, let's just, maybe it's something like they hadn't told their mom yet or something, and then mom has all these questions, they can bring mom over and we can just have a virtual visit into it. So it really has facilitated, I think, access. It's very easy to jump on. For instance, I could do one here. I'm at a conference, but should I need to see a patient, I have my cell phone, I bust it out anywhere that I have, a telephone signal, and as long as it's in a private place, I can do it there. So it really allows me some flexibility as well as a provider to, if I need to fit someone in urgently, or care for someone, I have that ability as well.